we're going in depth into nutrition and metabolism shift, why weight management feels different now, and what actually helps. And this is very, 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 very personal to me, right? Dr. Sangeet, why are we getting belly fat?
Okay, no, but firstly, Freda, I think you're doing a great job. You look amazing.
Okay, I'm doing the
Okay,
best.
so just continue doing whatever you're doing. And when I see all your Instagram posts, you're like lifting the weights, you're doing the resistance. That's the way to go.
Right, okay.
So be
Right. Why?
So when it comes to belly fat, right, it's one is the cortisol levels, right? Now you're talking about stress. We talk about cortisol, which is supposed to be, it's fight or flight. You can have burnout, which is too low, but on the other hand, you can have the one that is actually very high. So high cortisol, somehow the fat distribution, it goes towards the abdomen, the belly.
Right.
So that's one of the reasons. Now the other thing is basically, and we are going through all this menopausal shift as the estrogen level declines, even progesterone as well. Progesterone actually burns fat.
Right.
Low progesterone, you have water retention, right? So that's also one. And the kind of estrogen that we tend to produce in menopause is the E1, is the not so good estrogen, which causes inflammation, pro-inflammatory. But it also causes a bit of a weight gain because when your body is not producing, your fat cells are the one that is going to start producing the estrogen, which is not the healthy estrogen.
Right. Okay. And it all connects as well, right? I mean, there is a poor sleep, again, that also affects your weight gain.
Can I emphasize a little bit on that? So there are two types of hormones, ghrelin, leptin.
Okay.
Now, when you don't sleep enough, sleep issues, insomnia, your ghrelin tends to increase.
Okay.
That's when you start gaining weight. You want the leptin. The leptin keeps you lean.
Okay. And that is why, because we also, I know already as it is, women from your 30s, we're going to be losing muscle mass as well, right? And that also, right, if we don't do weights, it's going to help us put on more belly fat.
Yes. Right. So now you mentioned about the organ of longevity. The body's organ of longevity is the muscles.
Right.
So study shows once you're already at perimenopause, menopause, every decade, you lose up to about 12% of, muscle mass.
Right.
The bones, you lose about 1 to 2% of the bone density, right? So, and that's also one important thing. You need to do your BMD, bone mineral density. You got to check where exactly you are.
Right.
The minute you hit menopause, just do a baseline. And then you repeat every 2 years or so, right? Now, coming back to the weight before I lose my train of thoughts, it's the thyroid. A lot of women have sluggish thyroid as well.
Mine is very sluggish. Sleepy.
So it's fine. So it's like just got to address, you got to optimize your thyroid.
And the bone density thing, right? I mean, that's where you go into family history. So my mother has osteoporosis, right?
Okay.
And that's where I'm very concerned. And of course, I understand her diet at that time, right? So I'm trying to address it with my diet, but I know that I need to do more.
Correct, because mom wasn't on HRT.
No, not that time. Where do you know?
Yes.
You know, things about.
Okay, so that makes a difference, right? Mom menopause, you're deprived of the estrogen, progesterone. Sooner or later, you're going to, end up with osteopenic, osteoporosis. It progresses. So that's when the indication, of hormonal therapy comes in. So according to American College of OBGYN, the indication of, hormonal treatment, BHRT or, HRT is basically the vasomotor symptoms. If you're having a lot of hot flushes, that's already an indication. Okay, take a hormonal treatment. Number 2, prevention of cardiovascular disease. So the number 1 cause of death in menopause women is heart disease. It's not cancer. Cancer has just been a scare.
Like everybody is giving more prominence. Right. And then but where the secret, right? I'm not a secret, the hidden almost, right?
Yeah. Because now when we talk about the misinformation and then the studies and it's being outdated. So now with all the latest studies, so coming to the indication, the third is basically prevention of osteopenic and osteoporosis, right? Because the risk, once there's any fall, fracture.
With my mom, right? Just last year, she just fell and she broke her femur, right? And I was like, okay, I can't, this can be my future, right? If I don't do something,
do anything about it.
Right? Don't do something about it. Can we increase our metabolism? Sorry.
Okay, can I finish the last indication? As we mentioned just now, the genitourinary syndrome, menopause.
Right.
So, because I think that's where the libido, effects comes in.
Yeah.
Right. So you want to prevent all those.
Right. So can we increase our metabolism?
Yes, we can. So one is basically, let's stop talking about the hormones, it's the weight training. Because when you do the resistance training, it will definitely boost your metabolism.
Yeah.
The more muscle that you build, it is going to increase your metabolism.
Right. Okay.
Right? And then it comes to all the hormones. When you talk about the thyroid, very important for metabolism. And we spoke about water retention, because weight, sometimes when you look puffy, it's thyroid, it's low progesterone, and just balancing the hormones, doing the exercise, eating healthy, balanced diet, right? Protein is very important. The healthy fats. Lifestyle, definitely. The sleep, we mentioned. You want more leptin rather than the ghrelin. All this, overall, holistically, it will help.
I just want to bring out something that you talked about, and it's so important, right? Sometimes we feel we're so busy, but when we are stressed, we're not as effective. You'll find that if you are less stressed, you're actually more effective, and what you think takes a long time probably won't, right? It probably won't, because we're if we are not as stressed, right? We're more productive, more clear-minded, and more clear-headed, right?
Yeah.
So
brain fog and
all that. So we're a little bit more better managing, and actually we'll be a lot more productive as well. What about some sustainable strategies you should try incorporating? So strength, we should look at weight training more than cardio, because cardio seem to have stopped working as much for me.
Yeah, and there's always a point of time where you know that if you're not, there's something you need to shift.
Yeah.
And I think that's why your body is telling you now it's time to do the weightlifting, the strength exercise. Right. So we got to start lifting weight in order to build, right? When more than just the muscles, it's also important for your bones, right? Your ligaments, your tendons.
Yeah.
Stretching, yoga, Pilates.
Right. Less sugar in our diet for sure.
Oh my God. Do you have cravings? I do,
Yeah. More the salty stuff than the sweet stuff.
Okay, so for me, I have a bit more of a sweet tooth. But you know what? At the end of the day, I don't stock them in my fridge, because the minute you can always go to the fridge and you keep eating. So I think for me, it's waiting for the weekend and I treat myself.
Okay, so you do. Okay, so what I do also, as much as possible, I don't have sodas in my house, right? I don't have any of those drinks in my house, because I know, right? I have fruits, right? I have nuts, right? So I mean, it's still, anything in over is also not good, but at least these are the options in my house, right?
Yes.
So I'm very conscious about it, because it's so easy, right? You say, do I have cravings? Everything. I can have everything. More salty than sweet, but if they're sweet, I will also eat, right? So you know thyself, right? And then how do you then not? So I mean, even with my kid when he was young, I don't have sodas in the house.
And I guess, you know what, we can always explore with the recipes, like the healthier version. So now, that I've moved into my own place, so I'm quite excited, looking at all the recipe. Finally, I've got an oven, so it's looking, for those that is like gluten-free, but yet I'm able to control the sugar, the sweetness.
Right.
I've got options like kanto, the monk fruit rather than brown sugar. Now I've got coconut sugar. I've got all sorts of options that is low glycemic. So explore the recipes.
Okay.
Explore.
And what kind of protein should we take? And are all proteins equal, right? And the reason, I know we've talked about this a little bit, but maybe it's important to covering diet, right? The options for vegetarians and vegans.
Yeah. So I guess when you talk about the diet, now the vegans, lentils, tofu, tempeh, all those.
Yeah.
But I would say that a lot of the vegans, when they do the blood test, I can tell that their protein is inadequate.
Okay.
So then they can actually supplement with a protein powder before they go for their workout.
Okay.
Right? So that helps. So what is actually lacking in your diet and you feel that you're doing your level best? Because a lot of them will say, Doc, I'm eating this, I'm eating, like they're so frustrated. And I said, okay, take protein powder. Right?
Okay.
So at least, you know that you can supplement them.
Right.
If you're not getting enough from your diet, or maybe your gut is not very healthy, it's not absorbing what you're eating.
Right.
Supplement.
Are all protein powder equal? Because we had this conversation.
You got to look for the isolates. You got to look for, they have got different, I know, some they have that hydrolyte, but I tend to go for the isolates because I know that it's dairy free.
Right.
Because I'm intolerant to dairy, I'm intolerant to gluten.
Okay.
And I've got family history of hypothyroid, family history of rheumatoid arthritis, mom's side, and mom had all this.
Okay.
So it's what am I doing now to basically prevent it, because I'm asymptomatic at the moment.
Okay, at the moment, right?
Yeah.
So the thing is, when you can try to prevent it, then hopefully it'll never be symptomatic,
Absolutely.
right? Okay, so the whole load of thing around food, the belly fat, still trying to work on that. But I think that my philosophy is, when people ask me what's happening right now, I said, well, the effects will be 10 years, 20 years down the road that I started doing something now,
Yeah.
as opposed to like,
Yeah.
okay,
So can I say something for those, who, a lot of them, they say, you know what, I don't have any symptoms. I never had any hot flushes. So I'm like, great, and they're not on any hormone treatment. I said, that's also great. So, make sure you look into your lifestyle, you look into, your sleep and your stress management. But there's one thing that I tell them, but you got to look at yourself 10 years from now,
right?
because that protection,
Yeah.
this is not to scare anyone,
Yeah.
but sometimes a lot of us, we don't think about it, nor are we informed about it. And 10 years later, they will say, how come nobody told me? Because I've got the other group who have not been on HRT, and then they come back and they say, how come nobody told me about this?
Yeah. So even some people who may not have belly fat, right, but you're not building muscles, right?
building muscles.
Because you think, I'm looking good, right, but you're not developing muscles. You are going. It's going to have an effect.
It's the quality of life.
It's the quality. I mean, how many times have we heard of some old person falling down, and then after that, the quality of life gets affected immediately.
Yeah.
Right.
Yeah.
So, and that's because there isn't enough bone density or strength. You could go on and on about this. But, hopefully it gives you a bit of a ground, understanding of how important the diet is.
Yes.
And how this will affect you. And, belly fat isn't your fault. Blame it on the hormones.